Today's Inside Tract podcast is part of the Global Perspective series, which is brought to you by the AUA International Programs Department. We'll hear from scholars of the past and present as they talk about what they've learned, how they plan on applying those lessons, and the impact of international collaboration on their professional growth, research, and patient care.
Welcome to the AUANews Inside Tract. I'm Divya Ajay. I'm an assistant professor at Memorial Sloan Kettering Cancer Center. I'm a functional and reconstructive urologist.
And I'm Evalynn Vasquez. I'm a pediatric urologist at Boston Children's Hospital. I specialize in bladder exstrophy, spina bifida, neurogenic bladder, as well as cloacal malformations and global health.
Great. We are excited to be part of the Global Perspective series, and we explore the AUA's Academic Exchange Program and the impact of global collaboration in urology.
Today, we're sharing our experiences in Brazil, including our time spent observing Dr. Barroso in Salvador and how those experiences have shaped our perspectives on training, patient care, and the global urology community. I visited and did my scholarship in November of 2025. And so I was able to see a lot of the reconstruction, that complex reconstruction that Dr. Barroso does.
And I did my exchange in November of 2023, and with Dr. Ubirajara Barroso, who's also known as Bira. So, Evalynn, what made you do the Brazil exchange?
So it lined up honestly with timing. And then Dr. Barroso specializes in the Kelly procedure for exstrophy patients. And that's something that I really wanted to learn. And so I had reached out to him, and he had accepted me like as a scholar. And so it ended up working out fantastically. And I was pleasantly surprised that it also worked out during the time of their AUA, the Society of Brazil Urologic Association. So that worked out really well. So what made you decide to do the Brazil exchange?
Yeah, so similar to you, I was very interested in exploring, different ways reconstructive procedures are done internationally. I've had a few of these experiences internationally. I've been to Pune with Sanjay Kulkarni, and did the IBU exchange in Vietnam with Joel Gelman. So I feel like when we get into practice and we're kind of in our zone and we're just doing the same things over and over again, sometimes it's good to sort of pause and just think about doing something new, doing something different, and learning from other people. And we know Brazil has a lot of reconstruction and is a world leader in innovation in this area. So I'd applied to the program, and I was just really excited to go build some international collaborations and be part of the program.
Can I ask you how many years have you been in practice before you did the exchange?
So that's a tricky question because I actually applied for it in 2019, which was the first year I started practice. But then
Okay.
COVID hit. Because
Mm,
of COVID, the SBU, the Society of Brazilian Urology, the meeting was canceled for 2 years.
mm,
And I had a baby the third year. So it was postponed
mhm.
a little bit, but they were gracious enough to accommodate me when I was able to go in 2023. So I was about 4 years in at that time.
Great. So I applied, I think I was right at my 8th year of practice. And then when I ended up going was right at my 9th year of practice. And I think it was a really good time for me to do it
Yeah.
because like you said, I was already like set in my ways in a lot of, um, you just get into your routine. And this was a awesome way of rethinking about the same problem and um, kind of reinvigorating just being a learner again and being just like observing and seeing and being able to ask questions and approach problems from a different perspective I think was really good for me because I kind of knew what I didn't know and what I still wanted to learn. Um, so it's also interesting, they kind of put the age limit on it. And I think it is helpful because I started talking to everybody about this and I'm like, you guys need to do this. And I think that if you do get past a certain amount of time in your practice, you may not be able to learn as much or be willing to like apply what you've learned and what you're seeing. So I actually do think that that time period, when you're, still accepting like new techniques and asking, new questions, it's really important.
Yeah, no, absolutely. I can't agree more. And it's so different than some of the tele-learning and
Hmm.
internet learning that we do, or even like the little, tidbits of brain expansion you get at
Hmm.
the AUA or
Hmm.
GERS or whatever meetings you go to. Actually, just leaving your entire comfort zone
Hmm.
and going to a new place is
For sure.
very, very brain expanding.
Yeah.
So when you think back to Brazil, what is the
Hmm.
first moment or experience that you remember that like really stood out to you?
Oh, there were so many. So I started at at like the Brazilian AUA, and everybody was just like so welcoming, and was really proud to kind of show off, their culture and um, their community. And that was in Florianopolis. And the Brazilians really like to have a good time. And so they really wanted to show me a good time, which was awesome. And then going to Salvador, I was just really struck by how hard all of the surgeons have to work. Dr. Barroso goes to like 7 different hospitals,
Yeah.
and, half of them are private practice and half of them are community based and government run. And I can't remember if he was said it or if another faculty said it, but he was like, you go to the private practice to pay the bills, but then you go to the government, hospitals to fill your soul, because I mean, it almost is like two completely different systems and resources, and um, but that's also like how they practice, and it's not unusual for the surgeons to have to go to like 3 or 4 different hospitals and see patients until like 9 o'clock at night, um, to be able to care for all the patients that they care for.
Yeah, no, absolutely. And to flip that on its head for patients, I think there are a few safety net hospitals around here, but it's nowhere close to places like Brazil, where there's this entire tier of both preventative and,
Mhm.
complete care, very thorough care that you can get in government-run hospitals. And then, you walk into the private hospitals that you don't feel like it is any different than any hospital in the US.
Absolutely, absolutely. Yeah.
So it did feel like people were very cognizant of resources and very mindful of what they were using and being very efficient with the resources and time as well. Like you said, he is all over the place, even though like, I think of him as like in the Bahiana School of Medicine and Public Health, but he has
Yes.
so many different affiliations,
Yes.
so many different resource settings.
Right. What was most memorable and surprising for you?
I echo everything you said. That it was this immediate sense of just collegiality and respect. And most people speak English, but even the people who were not maybe as comfortable with English, with like my Spanish and their English and their Portuguese, and we just sort of made it work. And I just
Right.
remember the Bahian food being just incredible, and
Yes.
just I really actually enjoyed the SBU meeting. I did not realize how big it was. It is the third largest urological meeting in the world. I did not know any of that. And yeah, we've got to meet and hang out with all the AUA leadership. Dave
Mhm.
Henson was there, Fernandez
Mhm.
Luis Torres, the Brazilian Society, and I also was so it was so nice to be part of the Brazilian Society of the Women in Urology in Brazil,
I
like the
agree.
orchids.
Yes.
Yeah, so special shout out to like Maria, Claudia, Bikuda, and
Yes.
Karen Jager, who I think were just so welcoming. And
Yes.
they, even though women in urology are only 10% in Brazil, they just had this big presence at the
Yes.
SVU.
Hmm.
And it was so nice to see that and be part of it.
Yes. You can really feel like the love and community and support of one another. And I think a lot of that is because they are such a small minority that they, really stick together and they really, really try to like uplift one another. And I felt the exact same way. And like they invited me to the luncheon and even like had a present for me, which I was like not expecting at
Yeah.
all. But it really just like goes to show like again how welcoming they are and how inclusive they are. Um, and it's yeah, it makes me a little embarrassed like when we have visitors like in the States. I'm like, gosh, I am not going out as much as they are to make sure that everyone feels like included and a part of like the day to day.
Yeah, I can't agree more. It just felt like we could do a lot more for people
Yeah.
coming here.
Yeah. Um, what did you think was differences in patient care or workflow that really stood out compared to the US?
Yeah, one thing that impressed me before the part we were talking, and you are a pediatric urologist. I'm an adult, reconstructive urologist, and as you obviously know, in the U.S., pediatric and adult reconstruction is separated.
Mhm.
And Bira, for example, he does the whole spectrum. He does
Right.
pediatrics. When I was
Right.
there, he did a lot of adult cases. He does
Mhm.
gender affirming surgery.
Right.
And I think this cross pollination is really interesting because it leads to a lot of innovation and creativity. You can learn from many different practices and, really grow. So I thought his breadth of practice was fantastic. Um, I really enjoyed also the integrated learning, right? So a lot of times, like in my fellowship, there were three attendings. I was the only fellow.
Mhm.
With Bira, there's like at least four different fellows with him. And then there's
Right.
junior faculty, there's medical
Right.
students, there's residents, there's like all these different people coming together to
Yes.
learn and take good care of patients. And I that was definitely different and great, right there, a really good system. And then, the resource utilization, right? In a lot of the
Mhm.
a lot of places, the I think they're like the kits that they're opening are just very deliberate, and
For
everything
sure.
that's opened, is thoughtful. Like,
Mhm.
like case yesterday, and there was a pot scissors and a regular scissors, and I was like, I don't want the pot scissors. I just want the regular scissors. Why was the pot? So I think just so many like things
Yeah.
that are being used and just excessively opened and utilized with every when you're paying for every single
Mhm.
resource, you become very
Mhm.
mindful and very careful of what you're doing,
Mhm.
and that really stood out to me.
Mhm. I couldn't agree more. And I mean, you really also see the difference in the resources between like the private hospitals and the government hospitals. And the oftentimes it comes with like a lot of frustration, for the surgeon. You're just, you have to use whatever instruments that they give you, and you just have to make it work. But it doesn't I think it really, like, tests the skill level of the surgeon
Sure.
to be able to, do these, like, complex reconstruction, and have
Go with the
such good
flow.
Yeah, but it's humbling too, so,
Sure.
it makes me appreciate, but also makes me, like, cognizant of, like, what I'm complaining about. And what what 'cause, like, how it could be.
Yeah.
Um,
Right.
and so, yeah, a part of that, just observation, is very humbling.
Yeah. Yeah, absolutely. Yeah, you're right. And then so what about like outside the hospital? Was there any
Mm.
part of the experience that you particularly stood out to you?
Yeah. So I mean, the fellows were so good to me. They made sure that, I was picked up and dropped off and that, they would take me sightseeing and they would like take me to, the food stand that they was like their favorite food stand. And they would, they just took such good care of me. And then, Bira also, like, he invited me to his house. And I mean, just the hospitality alone, you, you could just see the pride in their culture, and how much care they have when they have a visitor come, to make sure that like that we're taken care of and that we have like the best experience and that we're learning the most. And um, yeah,
Yeah,
it was
absolutely.
it was remarkable.
Yeah.
And everyone, kind of warned me like, be careful in Salvador, like don't walk around by
Yeah.
yourself. And I did, and it was actually, I mean, I grew
Not
up in
bad, yeah.
LA, and so, you just have to be, I think, aware of your surroundings. But I did not feel not safe.
Yeah, agree.
Yeah. And I mean, it was beautiful, it's right on the coast and the weather was amazing. The fellows were showing me like videos of Carnival, like
Yeah.
in Salvador.
Yeah.
And so it's like, okay, I definitely want to make it back.
Yeah. Yeah, when two small women tell you it's safe, then
Yeah.
it's safe.
Yeah.
No, I can't agree more. The Bahian culture and the food were
Yeah.
just such standouts. Like
Hmm.
you said, the fellows like pick you up, drop you off. Like they hosted this like Brazilian Thanksgiving dinner at Deer's house. It was like
Oh,
so fun.
yeah.
And it just Brazil itself was very, I spent some time in South America, but I've never been to Brazil before. And it's such a standout place, right?
Hmm.
About 50% of Brazilians are mixed race, and there's just so
Hmm.
much diversity.
Hmm.
Uh, People are just so diverse and interesting. And while you do spend all the weekdays or most weekdays, I would say, in the hospital doing clerical stuff, I did explore,
Hmm.
kind of travel as well. And you got to see some really cool places along the coast. I think the probably my favorite was this big turtle conservatory, called the
Oh,
Tamar Project in Paria de Forte, um, and it was just most one of the most incredible things I've seen.
wow.
And yeah, it was beautiful, to spend time with the fellows and all their families as well, because they had
Yeah.
a lot of food, which is making me salivate now.
Yeah. Yeah. So I'm part one of the societies I'm part of is a society of fetal urology. And so one of the members had actually taken me, and a couple of the members of our society like also came down as well. And so we during the meeting we got together and like did like the food tours and there's like some walking tours, and it was amazing. But again, I wanted to learn like the Kelly procedure for exstrophy. And another like standout moment for me was the host had like picked me up. So I left Salvador, went to Sao Paulo, and got to see like an extrophy case, which is pretty rare, just outside of Sao Paulo. And but again, like just the dedication to make sure I had like the best experience. Like they really went over and above anything
Yeah.
that I would have expected or even asked for. Um, and it was phenomenal. And um, the the education system, like the medical system, the medical students have to do they like have to publish in order to
Mhm.
graduate. And so
Yeah.
the medical students are very hungry to do
Mhm.
research. And so Dr. Barroso like would sit with them and come up with projects with them, and they were so invested,
Yeah.
and like so motivated because part of it is that they have to, but they really are. You could see like in their interest, especially if they want to go into urology to publish these papers. And the medical system is almost like a microcosm of the world
Mhm.
because they collect all of this data. And so they're able to do these great projects with this data because it's just such a microcosm of all of these rural versus, city, and resources versus no resources. And so um, it's really makes an impact that using Brazil as like a microcosm of for the rest of the world and like medical questions.
That's so well put. Yeah. What is why do you think programs like these are valuable, and like do you have any advice for people who might be interested in applying?
Absolutely. I would say I don't think people know enough about this program to take
Mhm.
advantage of it. And so I'm trying to do my part to, advertise this as much as I can, like to the people that I know and to, the fellows that are graduating. I'm encouraging everyone to apply when you can, as often as you can, I guess. I don't know if you can do it multiple times. Like I want to sign up for like another one. Um, but I there are not enough good things that I could say about it. And coming back and like meeting people at the AUA who have gone, like yourself, and the network that you make, just being part of the program is so valuable. And I can't encourage people more to apply. And go and stay as long as you can. I went, I think, for 2 weeks. And then 1 week was for the AUA, and I wish I could have stayed longer.
Same. Yeah, and actually, that's a really good point. I hadn't thought of that. But the people who go to these programs are also sort of very curious and very interested, and interested in learning. So not just the host, and of course, I mean, those were incredible in the highlight. But
Hmm.
just even the people I went with,
Hmm.
the my travel partner. I guess there's always two people. With
Right.
Michael Sorial, he's an endourologist, and he also had just the best experience. And I remember
Yes.
him just diving into this like robotic uroscopic procedures they were doing there. And he also, I mean, had just an incredible time. And I emphasize what you said, that the partnerships and the friendships you
Hmm.
make are
Hmm.
also just really great. That's awesome. So
Great.
yeah, people should apply, and of course contact us if there's any way, anything we can do to kind of help with that.
Yeah. Thanks for listening to AUA News Inside Tract and our Global Perspective series.
Thanks, guys.
This has been Global Perspectives, an AUA News Inside Tract podcast brought to you by the AUA International Programs Department. For more information about AUA's International Exchange Program, visit auanet.org/exchange.